I'm Ben Wilkins, and this is my article, Eau De Vie, Why Water for Healthy Aging and MSK Health. We're all getting older. We see it month by month, year by year, a little creaking our knees, a new prescription for our glasses, or the smile lines deepening in our faces. We're all affected by the passing of time, but collectively, the increasing number of older people in the population is presenting a big challenge to society, with a good proportion of the challenges linked to MSK conditions. Last year, in his annual report, the UK Chief Medical Officer focused on the UK's ageing population and the impact poor health is having on older people's quality of life. As the average lifespan is increasing, so are the number of years we are living with health conditions and disability. This impacts the people reaching their 60s, 70s and beyond, their families who often pick up caring responsibilities, and it also puts colossal pressures on health and social care services. What's more, those living in the poorest neighbourhoods are spending more years in poor health, compounding huge inequalities across society. In the article, you'll see a chart by Sir Professor Chris Whitty looking at the most deprived to the least deprived in terms of life expectancy and number of years lived in poor health. We're living longer lives, but not better lives. Over the 20th century, modern medicine raised the average global life expectancy from 30 to 72 years, and it's projected to be over 90 by the end of this century. We're living longer and longer lives. The catch is that we're spending more of those years of disability due to health conditions and poor mobility. On top of that, there are huge inequalities, with ethnically diverse and low-income populations experiencing a far worse later life. Not only are the poorest living shorter lives, but they're spending more of their later lives living with disability. And this isn't just a problem affecting the UK, but all nations. The global population is getting older rapidly. By 2050, the EU is going to have a much older population than today, with more people being over 50 than under 50. There is a growing need for services to support this older population to maintain their health and mobility. In the article, you'll see a population pyramids graph depicting this shift in age of the EU population. Why water? Water is an enabler. Its buoyancy allows you to exercise without putting as much pressure on bones or joints, and at a higher resistance than on land, facilitating harder training for the whole body. Aquatic exercise allows you to effectively decrease the impact of your exercise without reducing the intensity. Aquatic activity is low impact but high reward. Importantly, the low impact and innately supportive properties of water overcome many of people's biggest barriers to exercise: pain. Not only does it result in movement that feels less tender on joints, but the neuromodulative changes that take place during immersion in water mean that people's experience of pain is also dampened, making movements that may have been a struggle on land more achievable. Exercising in water is versatile. It can be many things to many people, a fun and easy and social way to introduce exercise into an exercise routine, a vital part of rehabilitation programs, or an effective, low-impact alternative to high-impact forms of exercise. It can be particularly valuable for older adults, people who have sustained injuries, or those with conditions such as arthritis or back pain. Best of all, people can easily take part in water-based exercise, even if they're a non-swimmer or not the most confident in water. There are many benefits to exercising in water. It allows more people to access exercise in unique ways and provides a different way of training. One benefit of water is that it creates hydrostatic pressure, which reduces vascular, blood vessel resistance and heart rate. This reduction in heart rate allows you to exercise at a higher intensity than on land and avoids putting strain on your heart. Aquatic activities are especially beneficial for people with joint mobility or pain conditions, and it allows people to self-manage their conditions, reducing pain and increasing their mobility. It has also been demonstrated to be effective in supporting a wide range of health conditions, including broader MSK conditions, persistent or chronic pain, older adult mobility and functional challenges, neurological conditions, stroke, and cognitive disorders. For these conditions, research highlights that aquatic activities are effective for symptom management, improve quality of life for those living with the conditions, improve effectiveness of other treatments for the condition, are as effective as land exercise, and in some cases are more effective than land-based exercises. The challenges of access to aquatic activity. It was highlighted in the report by Muscular Dystrophy UK that there are more canine hydrotherapy pools than human ones. The pandemic has further impacted access to hydrotherapy, as many pools closed and are not back to full pre-pandemic capacity. The National Axial Spondyloarthritis Society, NASS, is leading the Hydrotherapy Alliance, a mixture of representative health bodies and charities to raise awareness of the importance and role of hydrotherapy pools, and are working to prevent the closure of hydropools. Nonetheless, hydropool demand outstrips provision, and in order to support wider society, it is essential to include public pools into the mix as part of the provision for access to aquatic health and well-being. Swim England, the national governing body for swimming pools, has a handy pool finder where it's possible to filter pools for aquatic physiotherapy, health sessions, and good boost sessions, to find publicly accessible pools with a health and well-being focus. There are over 4,000 publicly accessible pools in the UK and almost 500,000 worldwide. There already exists a national and global network of pools which can positively impact healthy ageing and MSK health. As part of the UK Research and Innovation funded programme called MSK Hubs, led by the organisations Good Boost, UK Active, Arthritis Action and Orthopaedic Research UK, a central element was delivering personalised therapeutic aquatic activity programmes in public pools, alongside land-based escape pain programmes and arthritis cafes for peer support. The aquatic element was reported in the qualitative feedback as an important part of the participants living with MSK conditions' self-management. Beyond MSK and healthy ageing, brilliant initiatives for mental and emotional health have also been lighting the way for public pools, with mental health swims, another initiative using community aquatic spaces to improve health and well-being. Swim England have also worked to expand the access to both training for clinicians with their e-learning programs and information for people living with health conditions and considerations for swimming and aquatic activity with their water wellbeing program. Although access to traditional hydrotherapy can be limited, there is a national and global opportunity to transform swimming pool spaces into therapeutic places for healthy aging, health and well-being. In summary, we have a rapidly aging global population. Existing and future health and social care systems are struggling to cope with the demands of poor health and disability in the later years of life, and there is a large and growing demand for consumers to purchase and access services to manage their health and well-being. With this new customer market of older adults who want to buy memberships and services to maintain their health and mobility, it's ready for gyms and pools to capture. Furthermore, there are remarkable products available for gyms and pools to incorporate into their offering and classes to support this new and growing health-conscious consumer market.